Shelly Singh. I'm Senior Consultant Obstetrics and Gynecology at Rosewalk Healthcare. So on Nutrition Week, today let me touch upon a topic which is slightly offbeat. I will be talking about micronutrients in pregnancy. A lot has been said about macronutrients, so today let's just focus on the micronutrients. So first of all, let me just guide you through the general principles of eating healthy in pregnancy. It's a good idea to have high quality nutrient dense foods and to limit highly processed food with empty calories. You have to say a complete no to alcohol as well as to smoking. And the FIGO also recommends that there are food items which should be taken for special food categories for special needs patients. For instance, patients who have high blood pressure, diabetes, people who have multiple gestation, people who are vegan, who are vegetarian. So we all require a specialized package during pregnancy, and it's a good idea to talk to your doctor or to a qualified nutritionist about these food items. So let me talk to you today about the micronutrients in pregnancy. So some of these micronutrients, what are these micronutrients in fact? So micronutrients are defined as food items which are required in very small quantities but which have widespread ramifications on the health of the mother as well as on the baby. So we say we are what we eat. Our babies are also what we eat in pregnancy. Remember that. So some of these micronutrients that I would like to touch upon are the iron, folic acid. I would like to talk about iodine, zinc, the vitamin B complex, vitamin A, as well as calcium and a wide range of other micronutrients which will be difficult to actually cover in this little presentation for paucity of time. So first of all, let me talk to you about the folic acid. Folic acid is a vitamin which is required even before pregnancy. So remember that 1 to 2 months before you actually become pregnant, you must start taking folic acid. It is required to the extent of 400 micrograms every day. But if you are a special needs patient, which means that if you have had a baby who had a neural tube defect, if you are diabetic, or you are on anticonvulsant medication, you will require higher doses of folic acid. So this folic acid is required not just as a supplement, but it is also contained in green leafy vegetables, in citrus fruits, etc. In fact, it's been seen that approximately 40 to 80% of the neural tube defects are reduced once we start taking this folic acid. Let's talk about the iron after this. We all know that iron is contained in the blood cells, and we all know that a deficiency of this iron is ultimately going to lead to anemia. In pregnancy, it is important that we guard against hemorrhage, because ultimately during delivery, whether it is a normal delivery or there is a cesarean delivery, there is going to be some amount of blood loss. So what guards against this hemorrhage is iron stores. So we must make sure that our iron stores are good, and what is contained in this, what basically contains iron is green leafy vegetables. There are some fruits. Apart from that, even non-vegetarian items such as liver, meat, etc. contain high quantities of iron. Apart from that, we talk about iodine. Now, iodine is mostly contained in fortified salt. Now, what is this iodine? It is important that we have iodine because it helps in the production of our thyroid hormones. And a deficiency of this is going to lead to cretinism. Cretinism means that the baby can be a little stunted, both developmentally, physically, as well as the IQ levels will be less. So it is important that we have enough iodine in our diet. Some of the other food items are zinc, vitamin A. Vitamin A, as we all know, is contained in eggs, dairy, fish liver oil, fish, liver, etc. And it also helps to prevent so many of the problems which happen later on in the life of the baby. Zinc, as we all know, prevents against anemia, neural tube defects. It prevents against low birth weight and anencephaly. B complex, as we all know, is contained in a number of vegetarian sources. So let us remember that there are a number of these micronutrients. The name is micro, but the ramifications are definitely macro. Also know that micronutrient intake leads to happy moms. So happy moms, positive moms, fit moms. That's all that we require in pregnancy. Happy Nutrition Week, all you girls.